watching the Isaiah Factor Uncensored.
And welcome back to the second half hour of The Factor Uncensored. What we are seeing now, more and more people are rejecting vaccines that are on the market. We brought in Dr. Danish Ali to talk about it tonight. And Dr. Danish Ali is here with us on The Factor Uncensored from Archpoint Pain Institute. Dr. Ali, I recently saw a study that indicated in 2025, out of 2,000 adults surveyed, 30% of those American adults had vaccine skepticism, meaning they did not believe it worked. And I'm sure if they don't believe it worked, it will be a trickle down to their children. And so we will have this generation, a large number in our next generation, who may not have the immunizations that they need to survive or could pass diseases. I know for one, we're having a problem with measles making a huge comeback in this country. So when you see that 30% or out of 10 adults, 3 say they are not willing to take a vaccine, your thoughts about that?
Yeah, it's an alarming number, Isaiah. I do agree with you. I think this is definitely something that historically we've had skepticism of vaccines, and it was even rampant during COVID. A lot of folks did not want to get the COVID vaccine as well. And so, to those folks, I think it's very important, especially if it involves your children, to make sure that you talk to your primary care doctors, your pediatricians about, well, listen, without being judged, what are, skepticism, or what are things that I may be harming or not doing if I don't do the vaccine, right? It's good to know both sides of it and then make an educated decision accordingly. As it relates to measles specifically, we've been seeing an uptick in the number of cases here in Harris County, and that closely resembles to the declining number of vaccines that these kids have gotten. Generally speaking, MMR, which is the measles, mumps, and rubella vaccines, are administered at childhood around the age of 12 months, and then another one at the age of 4 to 5 years. And what we're seeing is, Isaiah, those are the numbers that have declined over the years, and because of that, we're seeing an increase in the cases of measles, specifically in Harris County. Most of these illnesses, Isaiah, and most of these viral infections are either asymptomatic or they just have mild flu-like symptoms, and they get over it on their own. The problem becomes when this virus goes to another human being that may not have the same immune fighting cells, or they may be immunocompromised. Those are the folks that get higher risk of illnesses, and they get sicker, and potentially those folks that get sicker, it can affect the organs and they can end up being hospitalized. And so our message is still, consider the vaccines, but more importantly, discuss with your pediatrician or your physician what are the pros and the cons of not getting this vaccine, because you may just think, well, I'm putting something else in my body, but you may not realize some of the other downward effects that this may be having that you're not taking into account.
And of course, we're talking about Harris County and seeing the number rise here, but it's a problem around the entire country. And as you know, on The Factor Uncensored, people watch us around the country. We don't want to just lead them to believe it's only in Texas. We are seeing an increase around the country. And so when you have so many people who are refusing the vaccine, and you mentioned that those who may have immune systems that may be compromised, it could become a very serious case. Does that all become deadly as well for people out there?
It can, Isaiah. There are rare instances where this can become a lifelong illness where maybe your organs went into failure, and now you may be, on the list for a kidney transplant or a liver transplant because your organs stopped working. But there are cases, they are rare though, but there are cases of death that have been associated with this as well. So there are a lot of patients who end up, especially this is a illness that we see in schools schools, in daycares, and in kids. But again, it can spread to adults, and it can, especially if you have not been vaccinated, Isaiah. Historically, these vaccines, specifically the measles MMR, it is 97% effective with the two dosages at preventing and developing measles. And so these are actual vaccines that have been in the market for many years and have been researched as well to show how effective they are with very minimal or no side effects at all.
Dr. Ali, let's take a quick break here. We'll bring you back here on The Factor Uncensored and continue this conversation because it's very important for people out there. We'll be back with more Factor Uncensored in just a moment. And welcome back to The Factor Uncensored. We have Dr. Danish Ali with us talking about vaccines and how many Americans become skeptics or they refuse to get that vaccine. I think the recent poll indicated 30% of Americans in a sample group said that they had vaccine skepticism. Do you convince someone if they are convinced in their mind that there is something wrong with these vaccines? And we're not only talking about measles, we're talking about COVID, the standard one that many of us took as kids, measles, mumps, and rubella. How do you convince these individuals that it is okay, that you're not going to die when there's so much false and misleading information out there on the internet, on social media, and there are groups who are pushing it?
That's correct, Isaiah. And that's the difficulty that we have as physicians, is to make sure that we can have that sort of conversation with the patients and their children. There is movements out there. There's organizations that are anti-vaccines, specific driven. And I'll tell you, Isaiah, it's the job of the adult, the parent, to make the most educated decision possible by looking at both factors, right? These vaccines have been developed for many years, have been tested, have undergone vigorous animal testing and human testing to make sure they're as safe as possible, right? Having said that, there are folks who have that skepticism. Well, I got the flu vaccine and I still got the flu, right? There's a lot of variables in that. I hear that all the time, Isaiah. And sometimes it's because, maybe, you got that flu vaccine and you think it became effective immediately. It does take a few days for it to kick in and start becoming effective. That's number one. And number two, it's not 100% foul proof either, right? And so just because you get a vaccine, even for example, MMR or measles vaccine, for example, Isaiah, it's 97% effective after its second dosage. But obviously, many, many years later, the antibodies, they go down and your response may not be as strong as it would have been initially, right? And so we have to take into all those accounts. What I will tell you is historically, a lot of these vaccines do work, but moreover, if you get these vaccines and you still get influenza or COVID, the symptoms are a lot less, right? Your chances of being hospitalized are a lot less. Your chances of spreading this to somebody else that may have a lot of other medical issues and may develop more problems as a result of that are less. So your transmission rate is a lot less. So I really would urge folks to look at it from both standpoints and come up with that decision where they know the pros and cons and aren't just being led down a one-way street.
And of course, the efficacy rate on just how effective it is one thing. That's on the other side. But then you have individuals out there who are saying it is causing birth defects, it is causing autism, it's causing issues like that with their children, and there's been no solid proof on that, right, Dr. Ali?
That's correct, Isaiah. Some of the articles and social media take some of these things, and that patient and that child may have had other comorbidities or other illnesses, and they end up trying to find a way to link that or loop that to their mission and their whatever they are discussing, right? And so there is no strong evidence or no real supporting evidence of that these things or these vaccines, specifically the MMR, as we're talking about, has those sorts of defects or causes that. people will find ways to make those sorts of connections. And that's why I urge folks to get a solid answer and maybe seek, two or three different opinions, talk to, two or three different pediatricians or your primary care doctors, and make sure you come in with your pros and cons that you've discussed and evaluated before just coming up to an answer.
All right, Dr. Danish Ali, we appreciate your time, and hopefully we have convinced some people out there to do the right thing, or at least do the research they need before they just pull anything off of social media or the internet. I want to thank you, and of course, we'll be back with more Factor Uncensored. Stay with us.